Okay, this is the second part of my talk. So let's talk a little bit. So we talked about chincona and quinine and chloroquine and hydrochloroquine. That's kind of the sequence of how that came about. And that was a drug that's been around for a long time and it works against malaria. Well, what happens with malaria when we get away from the part of the genesis of the mosquito and the parasite and that, but actually what happens to the body? Well, here's what happens to the body. It causes a lot of inflammation, which releases mediators, tumor necrosing factor alpha, interleukin beta, interleukin gamma, INF gamma, natural killer T cells, endothelial cells, and it causes an increased marked up of the whole inflammatory system just goes crazy. There becomes an imbalance with angiotensin and endothelin 1, nitric oxide and T cells and platelets and everything becomes permeable to the endothelial cell, and all this damage starts occurring from alarmins and cytokinins, and coding for the proteins becomes destructive to all the tissues, and people start getting sick, whether it's their liver, their heart, their lungs. Well, the interesting thing is this COVID is very similar in its inflammatory response that it provides on the body, particularly in the lungs and the heart, and sometimes the kidneys, they're saying. So even though the disease process is a viral disease and this is a parasitic disease, the mechanism of the inflammatory response systemically is the same. And it may have to do with why some people do better and some people do worse, is because we found out in malaria that your genes can determine the course of the disease by the way the body reacts to the proteins that are circulating in your bloodstream, and your body's ability to mount an attack against whether it's a virus or an attack against a parasite. So what you have to do to survive, to keep the fluid out of your lungs, is to figure out how to dampen down that inflammatory response, but at the same time, kill the virus. So there's a line of thought based on this science that if you take zinc, you remember those things you used to stick in your nose, zinc, zinc, whatever it is, my wife likes to use them, or zinc tabs, because I thought zinc was really good to prevent colds such as the rhinovirus or coronavirus, colds that are similar to that. Well, the thing is with zinc, it tends to be outside the cell. And the problem is with this particular virus, it's an RNA virus, and it is inside the cell. And to get to it, the zinc is obviously toxic to this virus, but the zinc can't get in the cell. It has to have a channel. The theory is that chloroquine or hydrochloroquine opens up a gate and allows this zinc to get in here, and then that zinc decreases the replication of the virus. And a lot of our information that we use on antivirals goes back to when we talked about T cells, and when I gave my earlier talk, I talked about how kids are probably doing better with this because they have a thymus gland and they have an abundance of T cells. Even though they don't have a lot of memory, those T cells are in a position to gain that memory from exposure. So that might give them some a step up on this particular, not malaria, but on this particular COVID virus. So anyway, what does that mean in the long run? Well, I'm not saying that Fox is right, and I am saying CNN's right. When it comes to clinical trials are important. But also anecdotal information from doctors calling up another doctor saying, hey, I had somebody that was really sick, and as a last effort, I tried this and it worked. So when I had other patients, I tried it again. And a lot of times when they go back and they actually study that, they'll find value. Sometimes they won't. But let's think about this for a second. We've had big pharma do things before and say that there was clinical relevance, and then 10 years later find out that there wasn't, even though there were the great studies, because there's a hidden benefit. And just like this chincona was a medication that was utilized in the 1700s of great value, sometimes when you're chasing the prize for the value of something as opposed to the cure for something, there can be a lot of smoke. So in my own opinion, if I had somebody that was sick and I was worried that they were getting some of the telltale signs, their eyes were getting red, they couldn't hold their breath and count to 10, they were getting short of breath going to the bathroom, they had a whole bunch of comorbidities, I would take the risk of putting them on hydrochloroquine as opposed to the damage that this inflammation is going to cause their body lifelong, even if they survive, if there provides some benefit. So I think it's time for Fox and CNN to kind of wake up and not get in a discussion over who's right or who's wrong. Let the scientists and the doctors dialogue like I just dialogued with you, and let the doctors and the patients make their own decision. And I think in the future, you're going to find more and more people that had a good outcome from taking hydrochloroquine. And that's just said because of the science, the way I understand it. It may prove that when we study this in a double-blind controlled placebo trial, that we didn't find that. But I wouldn't want to be in the arm of the trial of the one getting a placebo. I'd want to be in the arm of the trial getting this medicine that might give me a chance. And that's my bottom line on it. So hope everybody is well. Maintain your social distancing. This is unprecedented times. Cross your fingers that maybe if this isn't the right medication, that it's in the right direction, and we'll find something soon. I'm Dr. Brian Gillis. Stay healthy.